1 out of every 5 Americans has a sleep-related breathing disorder. A greater number of Americans snore on a nightly basis, which is a symptom of obstructive sleep apnea. Do you snore? Do you have high blood pressure? Do you feel fatigued or excessively tired during the day? Have you been told you choke or gasp during sleep? Have you attempted any treatments for sleep-related breathing disorders?
Hi, Trina.
Hi.
I was looking through your health history and the forms you filled out about sleep apnea. Specifically, some of the questions have me a little concerned because they may indicate that you're at risk for obstructive sleep apnea.
Okay.
Otherwise known as OSA.
What is OSA?
Well, OSA, or obstructive sleep apnea, is when you actually stop breathing at night. When you go to sleep, your body's used to getting oxygen all day long. Well, when you go to sleep, the mechanisms that hold your airway open and keep you breathing, they go to sleep too. So when they go to sleep, they don't maintain a good airway and you stop breathing sometimes. If it partially closes your airway, you're just snoring. But if it totally closes your airway, that's when you develop obstructive sleep apnea. So what we do is recommend that you see a board-certified sleep physician. That would be Dr. Nabil Farah. He will then get you diagnosed. He'll give you a complete exam. He'll find out if this really is a condition we need to be concerned with. He will then probably suggest a sleep study, and then he will go over the different treatment options for you.
Okay.
Does that sound okay?
Yeah.
All right. Well, we'll get you the information and we'll contact him. We'll get that all set up for you.
Okay. Thank you.
18 million people in the United States have obstructive sleep apnea. What is worse is that up to 90% of patients with sleep apnea are undiagnosed or not being treated.
Hi, Ms. Reed. I'm Dr. Farah. Nice to meet you.
Thank you.
Well, I understand Dr. Smith sent you over here to be evaluated for obstructive sleep apnea.
Yes, he did.
Obstructive sleep apnea, as you may know, is a disorder where the airway can collapse or narrow at night. And when the airway collapses or narrows, it can cause your oxygen to drop. And we think that this drop in oxygen in the long term probably isn't a good thing. It can increase your risk factors for things down the road. So we're here to get you set up for a sleep study. And what's going to happen is you're going to spend the night in the sleep lab, and we're going to monitor various physiological parameters and see if your oxygen is decreasing and if you stop breathing, what's happening to the flow through your nose, what your heart rate's doing, what your brainwave activity is doing. So there are different degrees of obstructive sleep apnea. Depending on how severe your sleep apnea is, will dictate what our treatment options are. There are various treatment modalities out there, and they're all based on the severity of your obstructive sleep apnea. So what I'm going to do is get you set up for a sleep study. The sleep lab will call you to get that set up, and then we'll see you back here in approximately 2 weeks to go over the results.
Okay.
Ms. Reed, it's good to see you again.
Thank you.
Well, we have the results of your sleep study back. Turns out that you're having about 12 of these events an hour where your airway either narrows or it collapses. And that's causing your oxygen to drop slightly. And in fact, the lowest it went was 84%. Because you're mild, that gives you more treatment options than, say, someone who's severe. So typically for a mild case of obstructive sleep apnea, there are a couple different treatment modalities. One of the common treatment modalities is a CPAP machine, and the way that works is there's a machine here that connects to a hose, and then this connects to a mask. There are various types of masks that you can wear, and basically what it does is it pressurizes the airway with a positive column of air so the airway doesn't collapse
Those
at
look
night.
uncomfortable.
There is another very comfortable treatment option that patients seem to like. This is an oral appliance. This is the SomnoDent G2 oral appliance, and the way this works is it pulls your jaw forward slightly, and it creates a little bit more space in the airway and behind the tongue, and basically prevents the airway from collapsing by pulling your jaw forward slightly. Do you have a preference between the CPAP machine versus the oral appliance?
I prefer the SomnoDent G2.
Great. The next step will be to follow up with Dr. Smith, your dentist, and at that time he'll fabricate one of these devices, make impressions of your teeth, send those impressions off to the manufacturer, and he'll get that back in approximately 3 weeks. At some point in time, you'll follow up with me to have a repeat sleep study done to confirm that this is indeed eliminated those events where you stop breathing. I think you'll do very well with the SomnoDent G2, and we'll see you back here in approximately 1 month.
Okay, thank you.
Welcome back, Trina.
Hi, thank
Yeah,
you.
I heard you met with Dr. Farah.
I
Did that
did.
go well?
Yes, it did.
Great, great. Well, he reported back to me. He let me know that in your condition, with your specific level of apnea, that an oral appliance would be very effective.
Okay.
So, and I know that you chose that over CPAP, so I think I can understand why. I'll tell you what, let me show you what the G2 looks like. I think I talked about it a little earlier. This is the G2, and it's custom made. Now, this is on a model. The custom made appliance will obviously fit your mouth. So it's good. We're going to need to take very accurate impressions. We'll do that in just a minute. But this is the way it works. These wings keep your jaw from dropping back and your tongue from dropping back, closing off the airway. But you can open and close, you can yawn, you can drink water, you can yell at your husband, whatever you want to do, okay? So it's just less claustrophobic than other appliances that we have out there.
Okay.
So before we take impressions, do you have any other questions?
Yes, will my insurance cover it?
That's a really good question. Now, this is medical insurance. This is not dental insurance, okay? Because this is a medical problem. Okay. So medical insurance is required. We've already had SomnoMed check on your medical insurance specifically, and good news, it covers it.
Yay, thank you.
Do you have any questions about your insurance, about anything else before we get some impressions?
No, not right now.
All right. Well, let me go get April. We're going to take some impressions.
Work with your dentist and sleep physician to determine the best course of treatment for you and your lifestyle.
Welcome back, Trina. Good to see you. Your G2 is here. How about this? This is what we took impressions for a few weeks ago, if you remember.
I do.
Now, there's a difference between the two components. This goes on the upper teeth, and this one goes on the lower. And you can see these wings. That's how you tell the difference, okay? So the upper one always goes in first. And since you're going to be placing this every night yourself, go ahead and put that in and see if it's any problem doing that. It's custom made, if you remember, so it should fit your mouth perfectly. Okay, does that feel pretty good? Does it feel too snug? Does it feel too loose?
No, feels good.
Great, okay. Now the lower appliance. Bring your jaw forward a little bit first, and then place it over your lower teeth. There you go. Okay, now bite a couple of times. Does that feel even everywhere?
It does.
All right. Lean your head back for me. Kind of push your jaw forward, fall back. Does it feel like it's hitting evenly on the wings on both sides?
Yes.
Great, okay. Now, head back again, and then slide your jaw forward, back. Now let your jaw kind of drop down, there you go, and then close and drop down. Does that feel even everywhere, both sides?
Yes.
Good. Well, that's all there is to it. You can tell how well these are made. All right, let's go ahead and take them out. I want to show you how we keep these clean. Lower one out first, that's very good. Good. Okay, now there's some cleaning instructions. There's a packet that you're going to take home with you. It talks about how we clean the appliance every night. Now, one thing I want you to make sure and do, these will last a lot longer if you soak them in water. Now, they have a great warranty.
Always clean your G2 after each use. Your dentist will recommend that you come back once for further titration of the G2. Your dentist will communicate with your sleep physician when the G2 is titrated appropriately. Your sleep physician will recommend that you have a follow-up sleep study to document that your obstructive sleep apnea has been properly treated.